Hey guys, I'm Nichola Gaither. I'm a veterinarian here at the Animal Hospital of Statesville, and I'm going to talk to you today about echocardiography. An echocardiogram is an ultrasound of the heart. It's a view of the heart in motion. Similar to a pregnancy ultrasound where you can see the baby in the womb, you can see different parts of the baby and the baby move, an echocardiogram is the heart in motion. You can see different heart valves, you can see the chambers of the heart, their sizes, and you can even see how the blood flows through the heart. We can also see how well that the heart contracts or how well it does not contract. So it gives us a lot of information. An echocardiogram is sort of a step up from an X-ray. An X-ray is a two-dimensional view at one point in time. It's a still photo. Whereas the echocardiogram gives us movement and shows us a more complete view of the heart. I am not a board-certified cardiologist. I am a general practitioner here at the Animal Hospital of Statesville, but I do have a special interest in cardiology, and I have completed many continuing education hours in that focused study so that I can learn more about it and be able to provide echoes for our patients here. I attended the North American Veterinary Institute, which is a week-long intensive training with hands-on experience and training from experts in the field of cardiology. Prior to that, I completed a course at the University of Tennessee Veterinary College for instructional learning on echocardiography. We've also had a specialist come into our clinic so that we could learn echocardiograms on our machine here at the clinic. While this doesn't qualify me to be a board-certified cardiologist, it does allow me to provide valuable information to our patients and clients who are either unable to refer or it provides information to them prior to going on referral. I'm going to show you a few examples of echocardiograms we've done here in our clinic that have helped out our patients. This is an echocardiogram of a patient that was diagnosed with a heart murmur on physical exam. We heard the heart murmur with our stethoscope. This is a 4-chamber view. There are 4 chambers of the heart. In this echocardiogram, we see the left atrium, the left ventricle, the mitral valve that's sort of flopping around is where the murmur is located. The heart is just a big pump and blood should flow in one direction through the heart. When we have a murmur, that is caused by blood flowing in opposite directions. This picture shows Doppler, which is the flow through the mitral valve. Normally, we would just see all red and then all blue, but the mosaic pattern is detecting the murmur, which is the blood flow in opposite directions. So we found on this patient, even though it has a heart murmur, its heart is still pumping appropriately. So it did not need medication right now, and we will continue to monitor this patient. This is an echocardiogram we did on a patient that had an enlarged heart on the X-ray. The X-ray did not tell us why the heart was enlarged, so we did the echocardiogram to determine the cause. Here you can see pericardial effusion, which shows up as this black area here. The pericardium is a sac around the heart, the white line. The heart is being constricted by this fluid, by this effusion, and not able to pump effectively. This is an echocardiogram of a young patient that we saw that was lethargic and had a cough. We took x-rays initially, but that did not show us the problem. The echocardiogram shows the left ventricle, which should pump blood through the body. The left ventricle squeezes to contract the blood and pump it through the body. In this picture, you can see that the left ventricle is very floppy and it's not actually squeezing and pumping the blood effectively. This is a dilated left ventricle. This is another view of our same young patient that shows the comparison of the diameter of the aorta, which is this circle here, to the diameter of the left atrium. Normally, in a patient that's heart is functioning without problems, these two circles, or the two diameters, should be approximately the same size. As you can see, this circle here is about twice the size of the aorta. That means that blood is flowing back into the left atrium, and from there it flows into the lungs, which causes congestive heart failure. In a patient that has an enlarged left atrium that is not in congestive heart failure, we know that studies show that by starting them on medication, we can delay the onset of congestive heart failure. And this can only be determined by the echocardiogram versus the x-rays. There are few board-certified cardiologists in our area, and oftentimes they are booked months in advance. By offering limited echocardiograms in our practice, we're often able to start effective treatment or to rule out heart disease a lot sooner in our patients than having to wait on referral. My goal is to provide information that will help us to better serve and treat your pet. It shows the heart muscles. That didn't flow right. An echocardiogram is different than an x-ray. In an x-ray, that's a two-dimensional view of one. How much can you edit out? An An echocardiogram is different than a radiograph, or commonly known as an x-ray. God, that's the first paragraph. You have to make it sound good. Cardiologists are specialized veterinarians that have gone to school for extra time to be, I don't really know. I attended the North American, immersed in echocardiogram, that didn't sound right, at the North American Veterinary Sorry, where I received instructional learning in cardiography, I don't like that. Prior to that, I completed a course at the University of Tennessee Veterinary College, focused, I can't even say that. Here in the middle, the thing that's flopping around, is that appropriate?
Yeah. I mean, that's what it's doing.
That thing that's flopping around, okay. All right, let me put it.